Hi there. I just got back from another visit with Gray in the hospital. He seems to be doing much better, but he's still not eating much and feeling generally lousy. They didn't have a room for him, so they've given him the lounge to himself. The upside of that is that he gets a very nice view and a TV, and that I get a couch to lie on when I go to visit him. The downside of that is that he's still on a stretcher, which isn't as comfortable as a regular hospital bed. Now, I talked to Gray a little more about his experience with the healthcare system, and I wanted to share some of what he said because I think it's valuable to have the specific stories of individual people rather than just statistics and generalizations, which is a lot of what's out there about trans folks in the healthcare system. Now, a few years ago, I was part of the team that wrote the TransPulse project survey, which collected data from trans people across Ontario around access to health care. And even as we were writing the survey, it became apparent what the limits were to that kind of data without the context of personal stories. For instance, some of the questions asked if respondents had ever been treated poorly because they were trans. And of course, oftentimes when people receive poor treatment, they can only guess at the motives behind it. Other times, you might not even be aware of whether or not you're receiving poor treatment or whether you're receiving the same treatment as everyone else. So a yes or no answer to those survey questions can only tell us what a person's perception is. And it's only by collecting and comparing individual stories that we can get a really good picture of what's going on and what's causing it. So, as I said earlier, I've had very few interactions myself with the medical system. Gray has had a lot of experience with the medical system, including a lot of negative experiences. To orient these experiences, Gray is transgender, genderqueer, as well as being queer. He's a working class person of poverty. He's white, non-urban, high-functioning autistic. He's also adopted. And all of these are things that impact his experience and how he's treated. Being adopted is also significant in terms of health care because Gray, like most adopted people, has a weakened immune system and is more prone to health concerns. It's also significant because clinics and hospitals often ask for information about family history, which isn't relevant to adopted people. Sometimes, especially people with autism, will answer these questions literally, referring to their family and not to their birth family, which is what's intended. And so there'll be miscommunications, and the doctors will have inaccurate information. Gray has had a lot of trouble with the healthcare system, miscommunications, being ignored, all kinds of things. He told me that he was once sent home without treatment after going to a hospital in northern Ontario with pneumonia, and that on that occasion he heard the doctor justify it by saying, "Those people are liars anyways." And this was just after the doctor learned that he was transgender. So this isn't the only time that he was sent home without treatment, but it is the only time that he got confirmation that it was because he was trans. These past few years, he's been going through the process of trying to get chest surgery. Now, for someone who is male-assigned at birth and has breast tissue, this surgery would be covered by Ontario Health Insurance Plan, OHIP. All you need to do is get your family doctor to sign for it, and within the week you can get the surgery from any surgeon in the province. For an F to M, for someone who can afford to pay for their own surgery, and I think it's around $10,000 right now, it's gone up quite a bit in the past few years, you need 2 doctors to agree that you need this surgery. One of them has to be a psychiatrist, but then you can go to a surgeon of your choice, and again it takes about a week or 2. If you're an F to M and you don't have the $10,000 to pay for your own surgery, then you have to go through CAMH's gender identity clinic in order to get the surgery funded under OHEP. And this process takes years. And at the end of it, you don't get to choose your own surgeon. You have to get your surgery done in a clinic in Quebec that specializes in surgeries for M to Fs, not F to Ms. And you don't get any say in how the surgery is done, or things like whether it's done with general or local anesthetic. Things that you would get to decide for yourself if you were paying for the surgery yourself, or if you were male assigned. So Gray's anxious about this because general anesthetic is much more dangerous than local, especially for someone with a weakened immune system, and this clinic only uses general. He's also having some communication problems on top of the usual autistic communication problems because he doesn't speak French, and he hasn't been able to find anyone at the clinic who speaks English. He has finally gotten approval from CAMH after about 3 years. There were a lot of delays, and the thing about CAMH is that they don't always tell you why there are delays. They'll say, don't call us, we'll call you, and then they don't call you for months. These last few months they've been asking a lot of questions along the lines of, how are you going to afford to get to this clinic in Montreal? Where are you going to stay? And at that point, he might have still been denied funding if he answered incorrectly. There were a lot of questions about poverty and about his housing situation. And the argument is that they need to know if he's thought these things through, if he'll be able to take care of himself during recovery. But then, if that's their issue, why not just give their clients a list of all the resources that are available? Why not work with them to make a plan for how to pay for things like transportation to Montreal? They treat it like it's an exam that you have to study in order to get all the answers right. But if they already have these answers, then why not just provide them to the clients? And if they don't have the answers, if they genuinely can't work out a way that their client can afford to have this surgery, the surgery that's been deemed medically necessary and is covered by Ontario Health, then maybe that's a problem that they should be addressing. Maybe they should be lobbying Ontario Health to provide funding for these expenses. You can argue about whether or not the surgery is medically necessary. You can argue about whether or not there should be public health care, but as it stands, the province of Ontario has already decided that that they want public health care and that they want this surgery to be funded. So there really nobody should be denied access to surgery because they can't afford it. That's the whole point of having public health care. So while all this has been going on, and this has been very stressful, in the past year, Gray has also had to deal with a crushed disc in his spine and an infection in his face. And the crushed disc took a long time to deal with. There were several months in which the doctors assumed that it must be something much less severe and that he was exaggerating how much pain he was in. When he finally did get an x-ray and they saw that he needed surgery, there were a lot of miscommunications with the doctors. He couldn't get an appointment to speak to the neurosurgeon who was going to be operating on him. He tried because he had some questions to ask. The person he did speak with told him that he would be able to live a normal life after the surgery. He specifically asked about backpacking because that's an important part of his life. And the person he spoke to told him that that wouldn't be a problem. And I was there at the time, and this person seemed to be surprised at the question, acted like it was a ridiculous question. Of course he would be able to go backpacking again. After he had the surgery, he asked his surgeon how long it would be before he could go backpacking, and the surgeon acted like the question was ridiculous in the exact opposite direction. Said, well, of course you can't go backpacking again, why would you think that? And recommended that he take up golf instead. So, I have no idea how there could be such a serious miscommunication, but for some reason this sort of thing happens to Gray a lot. Also, it's normal for someone to be given morphine after a major surgery. In Gray's case, they were very reluctant to administer painkillers. Again, they seemed to think he was exaggerating how much pain he was in, even though they were fully aware that he had just had surgery on his spine. It seemed like they were making assumptions about him, like they were assuming that he was a drug addict. That's the only reason I can think of as to why they wouldn't give a patient painkillers under those circumstances. Everybody else in that ward was hooked up to morphine. Also, when he had an infection in his face, it took a couple of tries before he was able to see a doctor. They didn't seem to think it was as serious as he was saying it was. The triage nurse apparently thought that he just had a facial tattoo. So, now, Gray says that he's experienced less transphobia in the hospital here than he has in Ontario, either in Northern Ontario or in Toronto. A lot of people might be surprised by that. Toronto is often seen as a sort of trans-friendly, queer mecca. And there's a lot of stereotypes that people have about rural areas, non-urban areas being bigoted and hostile. He is still having a lot of trouble with communication that might have more to do with autism than being trans. Yesterday, they needed a urine sample, and the nurse gave him a male jug to pee in, and he had a really hard time explaining that he needed a female jug. He's also, he was also stabbed several times in the back of the hand while they were trying to get an IV in, because they just didn't listen or didn't understand when he said that he couldn't take an IV in his hand, that he's been in the hospital plenty of times before and it doesn't work. So they just tried that many times and it didn't work, and finally they put the IV in his arm. So I wish that Nurse Melanie could have come with him from outpatients, because she figured the hand thing out after only one try, and she was one of the nicest nurses that we've had so far. So there is a really frustrating combination of autism, weakened health, or weakened immune system, trans identity, as well as poverty, that seems to be resulting in him being stereotyped as a liar, as a drug addict, and not receiving proper medical health care. Right now, I'm doing the best I can to advocate for him while he's in the hospital, but that's not my area of expertise, so I don't know how helpful I'm being. Just from what I've seen of this hospital and the times when he's been in hospital in Toronto, I can say that I feel fairly good about the treatment he's receiving compared to in Toronto. So, and I'll be visiting him again soon. So that's all for now. Take care.